Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today is Tuesday, May 19th. It is 5 p.m. So, let's talk about using vitamin D as part of your health regimen. Now, vitamin D, I've gotten a lot of emails about this, how it can protect you against COVID-19. Now, we've been talking about sunscreen. And one of the issues with the overuse, in my opinion, of sunscreen is that we've created a huge number of people with vitamin D deficiency. Now, I'm not saying to not use sunscreen. I'm telling you should use mineral sunscreen, which we talked about the last couple of days. But you also need to make sure you're getting proper sun exposure in areas of your body that are not covered in sunscreen so that you produce the proper amounts of vitamin D. Now, according to Dr. Joanne Manson from Harvard Medical School, vitamin D is important to your innate immunity and boosts your immune function against viral diseases. Now, we also know it has immune modulating effects and can lower inflammation, which may be relevant to the respiratory response during COVID-19 and the cytokine storm that we're seeing in these really sick patients. Now, there is evidence that shows patients with respiratory infections tend to have lower blood levels of 25-hydroxy vitamin D. Okay, there is now some evidence from COVID-19 patients as well that are supporting the same thing. So the first one was just respiratory infections to begin with, and now it's coming to light that these COVID-19 patients who are very sick are probably in that same situation. Now, a study in South Asian hospitals showed the prevalence of vitamin D deficiency was much higher among those with severe COVID illnesses compared to those with mild illnesses. In fact, there was about an 8-fold higher risk of having severe illness among those who entered the hospital with a vitamin D deficiency compared to those with sufficient vitamin D levels. 8 times. That's big. Okay, that is very statistically significant. Now, there was also evidence from a meta-analysis of randomized clinical trials of vitamin D supplementation looking at acute respiratory tract infections, meaning upper and lower infections. Now, it was published in the British Medical Journal, so a very reputable journal, 2 years ago, showing that vitamin D supplementation was associated with a significant reduction in respiratory tract infections. Overall, it was only a 12% reduction, but among participants with profound vitamin D deficiency, meaning baseline levels less than 10, there was a 70% lower risk when they were given vitamin D supplementation. That is huge, okay? Now, a vitamin D level of less than 10 is very, very low, okay, just so you know. So the evidence is becoming quite compelling, and it's important that we encourage people to be outdoors and physically active while maintaining social distancing. Now, this will lead to increased synthesis of vitamin D in your skin naturally from your sun exposure. Now, again, we recommended sunscreen, so be sure to leave some skin areas that are free from sunscreen. Like what I'll do is these areas tend to burn my face, etc. So I leave no sunscreen on. I don't put any sunscreen on my legs when I'm playing tennis. And I've never gotten a sunburn on my legs. I'm not talking about when you're lying down at the beach. That's different. When you're physically active, the way the sun hits you, you're not going to be as likely to burn on your legs as you are on your back, your shoulders, your chest, your face, okay? But if that's not something that's appropriate for you, then just go outside for 10 or 15 minutes and sit in the sun. Be on the phone, read a book, just enjoy it and let the sun get on you. Now, diet is also important. food labels now have vitamin D content listed on the labels. So read your labels, but most foods are fortified with vitamin D, such as cereal and dairy products, but fatty fishes are good, sun-dried mushrooms, there's plenty of other options, but look into that and make sure you're getting proper amounts. If diet isn't adequate and if you can't get enough from the sun, then it's time to supplement with vitamin D. Now, the daily recommendation is the recommended daily allowance is 600 to 800 international units per day. But right now, during this time, I would probably encourage people to take at least 1,000 to 2,000 international units per day. I personally take 10,000 international units every other day. It is a fat-soluble vitamin, so it does get stored in your body, so I could either take 5,000 every day or 10,000 every other day. It's less expensive to buy 10,000 units because it costs the same. 10,000 international units, the bottle of 10,000 and 5,000 are the same price. Same number of pills. I take the 10,000 every other day and save myself half the money. Just what I do. So again, speak to your healthcare provider. Find out if this is something that you should be doing, you should consider doing. If you don't want to get your blood level checked for vitamin D, just start supplementing. Start with 1,000. It can't hurt you. You just want to make sure that your doctor thinks it's okay. Now, an interesting fact that I did want to throw in here, we know that COVID-19 was pretty bad in Spain and northern Italy. And interestingly, this doctor from Harvard reported that they have higher rates of vitamin D deficiency in those areas because they don't fortify their foods with vitamin D, and there is no recommendation in those areas to supplement with vitamin D. So, is it more prevalent in areas that are going to have people who have vitamin D deficiency? Very possibly. So, don't be that person. There's so many benefits to vitamin D. Google it. Go back, and I've talked about it many times, but here is just one more reason to take vitamin D. So I hope you guys are having an awesome day. I will see you again tomorrow for another Live in 5.